Hello everybody, thanks for coming to my channel. My name is One of a Kind Vlogs. If you're new to the channel, like, subscribe, turn on post notifications so you never miss a video. Comment down below. Now, you know what? I can do without my hat on today because I ain't got no hair. But I don't like it like that. So let's go. Let's get started. This is type 1 diabetes. I talked about type 2. Now I'm talking about type 1. Type 1 diabetes, once known as juvenile diabetes or insulin-dependent diabetes, is produce little or no insulin. Insulin is a hormone needed to allow sugar, glucose to enter cells to produce energy. Different factors, including genetics and some viruses, may contribute to type 1 diabetes. Although type 1 diabetes usually appears during childhood or adolescence, it can develop in adults. So you're not 100% saying that you can't get type 1 instead of type 2. Despite after researchers, type 1 diabetes has no cure. Treatment focuses on managing blood sugar levels with insulin, diet, and lifestyle to prevent complications. Key word: lifestyle to prevent complications. Symptoms: type 1 diabetes signs and symptoms can appear relatively suddenly and may include increase of thirst, frequent urination, bedwetting with children who previously didn't wet the bed during the night, extreme hunger, weight loss, irritability and other mood changes, fatigue and weakness, blurred vision. Consult your doctor if you notice any of the above signs and symptoms in you or your child. Now, let me point one on out. Your child had never wet the bed before, male or female, and all of a sudden they wet in the bed for some odd important reason. Go get them checked. Just don't spank that tail because you think, oh, you just peed in the bed. You just wet the bed. You don't know why they wet in the bed. If they ain't never done it, it's something out the ordinary. Go get them checked because they could have diabetes. I just want to point that out. Causes. The exact causes of type 1 diabetes is unknown. Usually the body's own immune system, which normally fights harmful bacteria and viruses, mistakenly destroys the insulin producing cells in the pancreas. Other possibly include genetic, exposure to viruses, and other environment factors. Now let me say something about that. I'm very strict about going outside. I can go outside and roam around all day. But why? When all these diseases is floating in the air. My immune system don't fight them all as quick as a regular person's immune system would. Causes. The role of insulin. Once a significant number of islet cells are destroyed, you produce little or no insulin. Insulin is a hormone that comes from a gland situated behind the below the stomach, the pancreas. Okay, the pancreas secretes insulin into the bloodstream. Insulin circulates, allowing sugar to enter the cells. Insulin lowers the amount of sugar in the bloodstream. As the blood sugar level drops, so drops the insulin from the pancreas. The role of glucose. Glucose, a sugar, is a main source of energy for the cells that make up muscles and other tissues. Glucose comes from two major sources, food and your liver. Sugar is absorbed into the bloodstream where it enters cells with the help of insulin. Your liver stores glucose as, I want to say the word, but I can't pronounce it. Let me say glycogen. That's how you say it. It's spelled Glycogen. When the glucose levels are low, such as when you haven't eaten in a while, the liver breaks down the stored, that word, GL, is glycogen, I think that's how you say it, into glucose to help your glucose levels within a normal range. In type 1 diabetes, there is no insulin to let glucose into the cell. No sugar builds up in your body bloodstream. This can cause life-threatening complications. Keep in mind, it says complications. Life-threatening complications. Okay. Risk factors. Some known risk factors of type 1 diabetes include family history. Anyone with a parent or sibling with type 1 diabetes has a slightly increased risk of developing the condition. Genetics. The presence of certain genes indicates an increased risk of developing type 1 diabetes. Geographic. The incidence of type 1 diabetes tends to increase as you travel away from the equator. What about that one? Age. Although age of type 1 diabetes can appear at any age, it appears at two noticeable peaks. The first peak occurs in children between 4 and 7 years old, and the second is children between 10 and 14 years old. Complications. Over time, type 1 diabetes complications can affect major organs in your body, including the heart, the blood vessels, the nerves, the eyes, the kidneys. Maintaining the normal blood sugar can dramatically reduce the risk of any complications. Eventually, diabetes complications may be disabling and even life-threatening. Heart and blood vessel disease. Diabetes drastically increases the risk of various cardiovascular problems, including coronary artery disease with chest pain, heart attack, stroke, narrowing of the arteries, and high blood pressure. Now, I heard I had something dealing with coronary artery disease, so I'm on top of that though. Nerve damage, I have this too, neuropathy. Excess sugar can injure the walls of the tiny blood vessels that nourish your nerves, especially in the legs. This can cause tingling, numbness, burning, or pain that usually begins at the tips of the toes or fingers and gradually spreads upward. Poorly controlled blood sugar can cause you to eventually lose all your sense of feeling in the affected limbs. That's why I say about below, I said this in the first one, below my calves and under, I'm like that. So, let's see. Damage to the nerves that affect the tract. I know it's gastrointestinal tract. Okay, I got you. Can cause problems with nausea, vomiting, diarrhea, and constipation. For men, erectile dysfunction may be an issue. No problem there. Okay, anyway, kidney damage. Kidney damage. The kidneys contain millions of tiny blood vessels clusters that filter waste from your blood. Diabetes can damage this filtering system. Okay, severe damage can lead to kidney failure and irreversible end-stage kidney disease, which requires dialysis or a kidney transplant. Eye disease. Diabetes can damage the blood vessels of the retina. Diabetic retinopathy potentially causes blindness. Diabetes also increases the risk of other serious vision conditions such as cataract and glaucoma, which I have. I've had cataracts and glaucoma in both eyes, so I know about that. Foot damage. Nerve damage in the foot or poor blood flow to the feet increases the risk of various foot complications. Left untreated, cuts and blisters can become serious infections and may untimely require toe, foot, or leg amputation. Only the two toes. Skin and mouth conditions. Diabetes may leave you more susceptible to infections of the skin and mouth, including bacterial and fungal infections. Gum disease and dry mouth also are more likely. Pregnancy complications. High blood sugar levels can be dangerous for both the mother and the baby. The risk of miscarriage, stillbirth, or birth defect increases when diabetes isn't well controlled. For the mother, diabetes increases the risk of diabetic ketoacidosis, diabetic eye problems, retinopathy. Pregnancy-induced high blood pressure and preeclampsia. Preeclampsia. Oh, I'm on a roll. Okay. Prevention. There is no known way to prevent type 1 diabetes, but researchers are working on preventing the disease or further destruction of the islet cells in people who are newly diagnosed. Ask your doctor if you might be eligible for one of these clinical trials, but carefully weigh the risk or benefit of any treatment available in a trial. I'm trying to see if that's it. Okay, that's everything as far as I know on type 1 diabetes. Because you can type type 1 diabetes in Google and it'll tell you anything you want to know. I'm just gonna give my insight of it because I'm type 1 diabetes. I talked about type 2 diabetes. Now the next video for part 4, I'm gonna talk about the foods you can eat and the foods you can't eat. It's gonna be like almost like a diet type thing. I am on a diet. But here lately I've been eating what I want to eat. I just weigh it in portions. You know, meat. I can have a small thing of meat, pork chop or whatever. About like this. If it's like this, it's okay. But my mashed potatoes, this much. My peas, this much. I can have all the vegetables I want. That's free food. Fruit, I can't have that much of fruit because fruit turns into sugar. It's just common sense. So I can have, now if I eat a banana, I'm supposed to eat a half banana, but I eat the whole banana. Getting back to hunger. But again, I'm in the video. If you're new to the channel, like, subscribe, turn on post notifications so you never miss a video. Comment down below. And feel free to put in the comment section, your thoughts of everything. I can try to answer questions the best way I can. If not, I'll seek somebody that knows about it more than I do. Remember, you're too blessed to be stressed. Love and happiness at all times. And I'll see you on the next one.